Hey everybody, I'm at the FCA convention down in Orlando, Florida, and we're here with SpineMED. I'm getting into SpineMED. You need to get into SpineMED. SpineMED is the most advanced and efficient decompression system available, just like it says right there. So if you've got neck pain, lower back pain, herniated disc, sciatica, this is it. And here's my good friend, Dr. Aubrey Tager. He's going to walk us through the SpineMED. Aubrey, take it away, my friend.
Hi everyone. So one of the major things that we see with decompression is that all decompression is the same. Why is this machine different than anything else?
I love that, yeah.
So one of the major things that happens with other machines is people say, you know what, I only get 40 or 50% improvement, if that. Now, why is that happening? The reason why that's happening is because you're getting paraspinal muscle spasm of those muscles up and down the spine, and that's actually causing a compression of the disc. So when that happens, you're going to have more irritation and you're going to have worse outcomes. Now, why does that happen? The reason why that happens is these machines are using harnesses that are going around the torso and around the pelvis, and they're pulling with a large lever force. So you have ropes and pulleys that are pulling and distracting the entire body. Now, when that happens, you're using up to 60 to 70% of the patient's body weight. That's huge. If I'm using 80 or 90 pounds of force, then that's what's going to cause the paraspinal muscle spasms to go and guard. You're trying to guard, you're trying to protect yourself. And consequently, these people are not going to get better over time. So you get limited response, you get limited improvements. How is this different? Well, let's take a look right here.
Right on.
So one of the major things that differentiates SpineMED to other machines is we have a patent on this. Nobody else in the world has this. So these restraints right here, they actually have on them, this is a surgical grade gel. So this is what they use with burn victims. Very, very comfortable. So this restraint here is going to sit right above the pelvis. So with that contact above the pelvis, we're starting here with metal, going to bone. So metal to bone into direct drive right into our motor right here. So we don't have to have that large force. Because of that, we're able to utilize 10 to 15% of the patient's body weight. That's huge. So what that allows us to do is to bypass that reflex paraspinal muscle spasm, thereby eliminating almost all of the inflammation and get much better results. What does that mean for the patient? It means that they're going to get better faster. They're not going to feel anything. They might come on this machine and say, hey, I don't feel it. It's not working. Well, it's working. We're not supposed to be feeling it. We're targeting the disc here. We're not trying to stretch the spine. We're not trying to do anything like that. This is targeting disc. We can target the levels. We can do that in the lumbar spine and in the cervical spine. So this is the most up-to-date, advanced, non-surgical decompression machine that there is, and this nobody else has. This is a huge difference.
It's a player.
It is.
So just cover, now this screen right here, that's so the patient can see.
Exactly.
Because they don't really feel like, when I was on the machine, it didn't feel like anything.
That's it.
But that the patient can see it.
That's it. So for you guys that are chiropractors that are doing diversified or Gonstead, and then you want to introduce something like activator, what's the first thing that happens from patients? Patients tell you, that doesn't work.
Yeah, right.
I don't feel anything.
Right.
Well, that's the perception that patients have. So if we put them on here and they're not feeling anything, they're going to tell you, you know what, crank it up. But if we crank this up to what the other machines are using, and because we're targeting the disc itself, you're really going to hurt, because this is very, very efficient. So by having this allows the patient to be engaged with the treatment. They can see the entire treatment in real time, and that's going to allow them to understand what's going on throughout the course of the entire treatment.
Cool. Beautiful. Yeah.
So in this machine we have, this is a hospital grade ELO computer. There is one here. There is another computer inside the table. So the two of these computers communicate with each other and then come up with an algorithm in order to determine how much force is going to be applied based on the patient's weight.
Nice.
We're keeping that, like I said, between 10 and 15% of the patient's body weight.
Because you're targeting the disc.
Exactly.
You're not just stretching the spine.
Exactly. Treatment times, 30 minutes. We don't deviate from that. It is 30 minutes based on research, and on average, 25 visits. And the reason why we say 25 visits is not because we want to get a new Mercedes or just take some random number.
Exactly, right.
The majority of our clients are actually surgeons. So we as chiropractors, we can order a pre-MRI. We can't order a post-MRI to see how things work. As a surgeon, they have to do post-MRI in order to see if they're still surgical candidates.
Right.
So we're getting feedback pre and post-surgical MRIs.
And I showed those to people. Yeah, man.
Yes.
It's very impressive.
So when they see those post-MRIs after the treatment on the SpineMED, then we're determining that on average it's about 25 visits, not to get a decrease in symptomatology, but a resolution of the problem. Now we got to be careful when we say this, because technically we can't cure or fix anything. But
the FDA says only a drug or surgery can treat or cure anything.
That's right. But what we're saying is when we look at the MRI, now all of a sudden that disc bulge or herniation isn't there anymore. Call it what you want, but it's reversed. Somehow it's reversed.
I like reversed. That's better. Yes.
Very good.
Yeah. So, and it's cervical spine too. That's up top. Let's just swing around here so people can see that.
The cervical spine is integrated into the machine. This is not
right
an
over
add-on
here
feature like other machines with a piece of plastic. This is the exact same restraint, just in a smaller model. And this is going to sit right under the occiput.
Right.
So this is a very comfortable feel for the patient.
Beautiful. Beautiful. This is the way to go, folks. I mean, there's no other system. If you've got back, neck, leg pain, herniated, bulging discs, this is the unit, SpineMED. Dr. Aubrey, thank you so much, buddy.
Thank you. Hope to hear from you soon.
Yeah, you guys got questions, email me, drmlj83@gmail.com.